Is malignant hyperthermia a plastic surgery anesthesia risk? Is malignant hyperthermia a risk during plastic surgery? Yes, it is a rare but serious concern associated with anesthesia. Malignant hyperthermia is an inherited disorder that can be triggered by certain anesthetic agents, particularly volatile inhalational agents and depolarizing muscle relaxants. This condition leads to a hypermetabolic reaction in the skeletal muscles, which can be life-threatening if not managed promptly. When someone with a susceptibility to malignant hyperthermia is exposed to triggering anesthetics, it can cause uncontrolled muscle contractions, a rapid rise in body temperature, increased carbon dioxide levels, and muscle rigidity. These symptoms can escalate to severe complications, including cardiac arrest. While malignant hyperthermia is rare, affecting about 1 in 100,000 patients exposed to these anesthetics, it remains a critical safety consideration in plastic surgery. There have been documented cases of malignant hyperthermia occurring during cosmetic procedures, such as liposuction and fat grafting. In these instances, early recognition of symptoms and prompt administration of dantrolene, the specific antidote, were essential for patient survival. It is important for plastic surgeons and anesthesiologists to be aware of the risk factors associated with malignant hyperthermia. These include personal or family histories of adverse reactions to anesthesia or unexplained perioperative deaths. Many individuals who are susceptible to malignant hyperthermia may not even know it, as symptoms typically appear only after exposure to triggering agents during surgery. To ensure safety, procedures can still be performed on patients at risk by avoiding these triggering anesthetics. Safer alternatives include local anesthetics, nitrous oxide, narcotics, benzodiazepines, and total intravenous anesthesia using non-triggering medications. Accredited surgical facilities, including many ambulatory surgery centers where cosmetic surgeries are performed, are required to have emergency protocols for malignant hyperthermia. This includes having dantrolene readily available to treat any acute crisis. Preoperative screening is crucial and includes a thorough anesthesia history to identify any potential risks. While genetic testing or muscle biopsy can confirm susceptibility, these tests are not routinely performed due to the rarity of malignant hyperthermia. During anesthesia, early signs of malignant hyperthermia may include a sudden rise in end-tidal carbon dioxide, muscle rigidity, especially in the jaw, rapid heart rate, and elevated body temperature. Recognizing these signs quickly and administering dantrolene along with supportive care can be life-saving. In summary, malignant hyperthermia is a recognized risk in the context of plastic surgery, though it is very rare. Awareness and preparation are key. By avoiding triggering anesthetics and having emergency protocols in place, surgeries can be performed safely even on patients who may be susceptible. Early identification and appropriate anesthetic techniques are essential to minimize the risk of malignant hyperthermia and ensure patient safety. Always consult with healthcare professionals for personalized medical advice and to discuss any concerns regarding anesthesia risks.